Ever wondered how medical professionals measure the severity of a brain injury? What tool do they use to assess, monitor, and make crucial decisions on the treatment of patients with an impaired level of consciousness? The answer lies in an ingenious tool known as the Glasgow Coma Scale. The Glasgow Coma Scale, or GCS for short, is a neurological scale that provides a practical method for gauging and tracking the conscious state of a patient. Invented in Glasgow, Scotland, back in 1974, this scale has since become a universal standard in the medical field. The GCS comprises 3 tests: eye, verbal, and motor responses. The minimum score is a 3, indicating deep unconsciousness or death, while a perfect score is 15, denoting a fully conscious person. To begin with, let's talk about the eye response. This test measures the patient's ability to open their eyes in response to stimuli. If their eyes are open spontaneously, they receive 4 points. If they open their eyes in response to speech, that's 3 points. If they only open their eyes to painful stimuli, they get 2 points. And if there's no eye opening at all, they receive 1 point. Next, we move on to the verbal response. This test gauges the patient's ability to speak and their level of coherence. Oriented and conversational speech earns 5 points. Confused speech, 4 points. Inappropriate words, 3 points. Incomprehensible sounds, 2 points. And no response, 1 point. Finally, the motor response test. This test is all about the patient's ability to move in response to stimuli. If they obey commands, they score 6 points. Localizing pain earns 5 points. Withdrawal from pain, 4 points. Flexion to pain, 3 points. Extension to pain, 2 points. And no response, 1 point. Adding up the scores from the 3 tests gives you the patient's total GCS score. The lower the score, the more severe the brain injury. To summarize, the Glasgow Coma Scale is a vital tool in assessing and monitoring a patient's level of consciousness. It comprises 3 tests: eye, verbal, and motor responses. The total GCS score, ranging from 3 to 15, provides a measure of the severity of a brain injury. This score can guide medical professionals in making crucial decisions about the patient's treatment. Remember, the Glasgow Coma Scale is a powerful tool, but it is not a substitute for a comprehensive clinical assessment. It provides a snapshot of a patient's conscious state at a particular moment in time, but it does not provide the full picture of their overall neurological health. So, while it's an essential part of the toolkit for anyone involved in the care of patients with an impaired level of consciousness, it's just one piece of the puzzle. It's the starting point, not the end point, of the journey towards understanding and treating brain injuries. So the next time you hear about the Glasgow Coma Scale, you'll know exactly what it is and how it works. And you'll understand why it's such an important tool in the world of medicine.